So this video just is an introduction. So my name is Sabrina Strickland, and I'm an orthopedic surgeon. I did my training. I started at Cornell and for undergrad, and then I went to Rush for med school, Hospital for Special Surgery for residency, and then I stayed there for a sports medicine fellowship where I've been in practice in New York City since 2002. And my specialty is sports medicine, but more specifically, I take care of a lot of complex knee and simple knee injuries. And we actually met at the International Patellofemoral Study Group.
And I was born in Munich and did all my medical school training in Munich and then came to Boston in 1998 for what was supposed to be a 3-month rotation. Kind of fell in love with the medical system over here, ended up doing 2 years of research in orthopedics and then my residency at Mass General and the Brigham as part of the Harvard combined residency, fellowship in sports medicine at Rush, and then back to Boston and joined the staff there at the Brigham and Harvard. And then after we met, I moved to New York and we've been in practice together since 2018.
So we kind of like to call our practice joint preservation, and when you first started calling it that, I made fun of him because I'm like, but ultimately, like, while we do replace parts of knees or actually total knees, we'd much rather preserve the knee. And so we do a lot of research, we do FDA trials, and we do a lot of surgery.
And a lot of people, even young people, come to us and they say, well, I've had this knee pain and I saw someone and I was told, well, you have cartilage damage and there's nothing to do except waiting until you're old enough for knee replacement. And that's sort of what joint preservation surgery is all about, is offering solutions for people who maybe at some point they need a knee replacement, but right now is not the time, but they have pain and there's something that needs to be done.